Let us discuss about a rotator cuff today, which is a very high yield topic for both USMLE Step 1 and Step 2 CK. Rotator cuff basically comprises of the four muscles. The first one is supraspinatus, which helps us to do the 0 to 15 degree abduction. Then the second one is infraspinatus. Infraspinatus is responsible for the external rotation at the shoulder joint. Third one is teres minor. Teres minor basically is supplied by the axillary nerve, which shares a nerve supply with deltoid muscle. It is responsible for adduction as well as the external rotation of the shoulder. The fourth muscle is subscapularis, which is responsible for the internal rotation as well as the adduction. Now we know the four muscles of the rotator cuff. We should know that rotator cuff basically acts as a strength to the shoulder joint and helps us to abduct our shoulder, abduct our arm, and helps us to do the overhead activities as well. But as the age advances, or the people who are engaged in certain professions such as carpenters or the people who paint the walls or the ceilings, in which in whatever profession there is over use and leads to the over abduction of the arm, it leads to the rotator cuff tendinopathy or the impingement or the tears. There are three pathologies which we need to know for these exams. First one is the rotator cuff impingement or tendinopathy. Basically, whenever there is repeated flexion or abduction in any profession, so what is there would be decreased space between the humeral head and the acromion. The space would decrease and the structures beneath these would be compromised. What would be the structures that would be compressed? That is the supraspinatus tendon as well as the subacromial bursa. So these are the structures that would be compressed, and their compression would lead to the impingement syndrome, which is a very important clinical case which we get to see in day-to-day OPDs in the orthopedic department. And to check for the impingement syndrome, there are two clinical tests, that is the Nees as well as the Hawkins-Kennedy test. We should know how to elicit this test because these disorders are diagnosed by clinical examination. Well, you need not to do any other investigations. They can be diagnosed clinically easily. So you need to know both these tests. Now coming on to the cuff tears. Cuff tears basically happen whenever the patient presents with an advanced age. The patient would be more than 40 years of age in most of the cases, and there would be history of the fall on the outstretched hand, or there would be a history of impingement syndrome. Like the supraspinatus tendon would be so irritated, after getting repeated impingements, it would get micro tears as well as the fibrosis, and subsequently leads to the complete tear of rotator cuff. So the patient would present as the pain at the lateral shoulder. Pain would not be the presenting complaint in case of tears. You need to remember this. In case of tears, the main presenting complaint would be weakness in doing the overhead activities like combing the hair or moving the arm overhead. And the passive range of motion, whenever you will do the passive internal or external rotation, it would be like totally normal. There would be no pain, no weakness, whereas the active abduction and the external rotation would be painful or weakness. The investigation of choice for cuff tears is MRI, because MRI is investigation of choice for any damn thing in orthopedics to see the soft tissue. And the treatment for cuff tears is surgery, which would encompass the arthroscopic repair of the tendon, supraspinatus tendon or any tendinopathy, and it should be done within 6 weeks for the best results. And the surgery should follow good physiotherapy, because after the surgery we need to mobilize the joint, and with physiotherapy there would be good mobilization and the joint would be in good position. The range of motion would be good, and the mobility will be restored within a specified period of time with good physiotherapy. Thank you. Stay tuned for the next video.